Good morning, good afternoon, everyone. Thank you for joining us today. We'll get started in just a moment, but just wanted to add a few housekeeping items and reminders as we all arrive to this session together. Um, if you're using your phone for audio, if you're able to, please dial in and put your participant ID, and that'll be able to link your audio and video if you choose to have your camera on if you're comfortable. Since this is a Zoom meeting format rather than a webinar, we do encourage you to remain on mute if you're not speaking. But if we have an opportunity for some interaction and you'd like to speak, you'll be able to do so. And then when you're not speaking, if you have questions or comments or reflections, please go ahead and put those in the chat box and we'll do our best to address them throughout the session today. And I'll pass it over to Xavier to go ahead and get us started.
Awesome. Thanks, Zach. Yes, welcome everybody. Thanks for showing up and thanks for choosing to spend your time here with us. We are here to talk about the second of 3 sessions on community safety through racial justice. Today, I will be hosting along with Laquana Williams, Zach Tarro, and then Lisa will actually be in the audience today as a participant. She's juggling a few different other deadlines that, you know, we have to do the work, and sometimes you just need to kind of do the best you can as you get these incoming inquiries. So this is us, this is the team here at PI that's worked on this project. I will give my colleagues a chance to introduce themselves, but in case you missed the first time, I'll briefly tell a little bit about myself. My name is Xavier Lofton. I am working remotely from Philadelphia for Prevention Institute, and I joined the team back in January. Before I joined PI, I was a member of the Philadelphia Department of Public Health, as well as Philadelphia Parks and Recreation. And I think between those two worlds is where I often find you know, my work, along with an emphasis on youth and youth engagement. So with that, I'm going to kick it over to Laquana. You're up. So it looks like Laquana may be having a little bit of tech difficulties right now. So Zach, in the meantime, do you want to introduce yourself?
Sure. Hi, everyone. I'm Zach Tarro. I'm a senior research assistant with Prevention Institute based out of the Bay Area in California. And happy to be here and joining everybody in community today.
All right. So as we wait for, oh, thought I saw Laquana join on. So as Laquana sorts out her tech issues, I guess we can go ahead and, you know, jump into a little bit more of the material that we had for you today. So if we can go on to the next slide. We're going to kick things off with a little bit of a warm up to get everybody in the mood to be active and participate. So I'll go ahead and share in the chat. Please give some responses in your work that you've seen some recent highlights or insights, some lessons learned while you're trying to pursue community safety work through this lens of racial justice. So I'm going to give folks about 60 seconds or so. You know, as you come in, as other folks start to filter in, go ahead and share some successes and some lessons learned since the last time that we met.
Hey, Zach and Xavier, I know folks are typing in the chat, but I was just wondering if you all can hear me now.
You're good to go. Looks like we got you on.
Awesome. Okay.
So while folks think about some of the successes and lessons learned they found in their work, would you like to go ahead and tell folks a little bit about who you are?
Of course, sure. Thank you. My name is Laquana Williams. I'm a program manager with Prevention Institute, and I am based out of our LA office in Leimert Park, and I'm super excited to be back for this second session on community safety and racial justice. So thank you all for joining us today.
Perfect. Okay, I see some folks starting to get in here on the chat. Got some public policy work talking about adequate support and resources for people to live healthy lives. That's kind of important. lessons learned about, how to interact with indigenous folks who, are the original folks who are on this land. We've got definitions of community justice. We all might not have the same definitions, and it's always good to be on the same page, especially when you're trying to advance the work of racial justice. So thanks to the folks who are able to give some responses. The chat is always open. Feel free to, post any comments, some feelings that you're having that might be, that might need to be addressed. And I'll do my best to monitor the chat so we can highlight those as they come along. So if we can go on to the next slide, let's introduce a little bit and forecast what we're going to talk about today. So a little nod to something that folks brought up in the surveys on our last session. There were some concerns that we might not have given enough examples or may not have really gone deep enough into different ways to normalize, prioritize, and incentivize this idea of truth, racial healing, and transformation within your work. So we're bringing that forward as an objective in this, just so we can be responsive to what folks are telling us in the surveys. A little bit of, not new, but a different way of looking at this in the next two objectives. We're going to look at some frameworks within the dimensions of time as we try to advance violence prevention efforts. And we're going to kind of look for and talk about how to learn where these strategic opportunities are and where you can advance equity and racial justice within your work externally, and even more important, internally within your organizations. I think everyone is, especially within the past year of the pandemic, this movement for racial justice, the momentum that it's received, it's really easy to say, yes, we want to be more present in the community. We want to have more of a community engagement presence, but just as important, if not more important, you have to think about how you're doing things internally and how that can either support the status quo or move us more towards that racial justice that we seek. So on to the next one. You've heard a lot from me, and I will go ahead and take a back seat here. We're going to talk about, or rather we're going to listen to a portion of a TED Talk from Dr. Gail Christopher, who has done amazing work through the William K. Kellogg Foundation about how to really have this racial transformation, this truth and reconciliation, and what that really means and how it can actually improve the health of all people within your organization, your city, your landscape, and your communities. So Zach, you can go ahead and kick us off with this video. And as you listen, again, the chat is open. You are more than welcome to share reflections, things that you think are really resonating for you, and things that you'd like to, call into question or really raise as something to talk about. So go ahead.
Hello. Are there any grandparents in the house? All right. Then you know that we have a very special secret that we just can't keep to ourselves. Becoming a grandparent is one of life's sweetest blessings. About a year ago, my first grandchild was born, and I was right there in the hospital. I couldn't be in the delivery room, but as soon as the baby was born and the mother was okay, my son-in-law came out to get me, to bring me in, and he assured me that everything was fine. He said, but I have to prepare you. And I was like, oh, prepare me? He said, yes, he's very pink. Well, my grandson it's an interracial marriage, and my son-in-law was part of an interracial marriage. But somehow we had convinced ourselves that this new baby was going to be this little brown baby. And we weren't ready for the pink baby, right? So at least that's what he thought. And so I went in and I held him, and there was so much love, and it was just unbelievable, the experience of joy. But I did end up saying, I'm kind of glad he prepared me. So It drives home the reality, the absurdity of how much skin pigmentation matters or doesn't matter in our lives. And I share that personal story because that's my subject matter, is how do we get over our fixation on this absurd notion of racial hierarchy? How do we jettison the fundamental undergirding belief in a hierarchy of human value? It has become the infrastructure, the mental infrastructure of our society. Now, this is a special year. This is 400 years since 1619, and it was actually this notion of a hierarchy of human value was actually codified into law right here in the state of Virginia. But actually, it was codified in much deeper ways 400 years before that by the church and led to the decimation and annihilation of indigenous cultures all over the world. So we have this archaic idea. Now, you know, TED is about ideas worth spreading. We need to come to grips with an idea that needs to come to an end. The idea So the idea of believing that somehow the human family can be divided into a taxonomy of value and worth based on our physical characteristics, it doesn't belong at all in the 21st century, and it began so many centuries ago. I've come to recognize that that idea is kind of like the mental, it's not kind of like, it really is the mental infrastructure of our society. Now, we don't really think about infrastructure. We don't think about the power grid. We don't think about our water systems. We don't think about all those things that become the basis of the design of our society. And this idea of a hierarchy of human value has become the basis of the design of our society. And that's why it's so important that we jettison it, that we get rid of it. And if there are any Star Trek fans in the audience, you know when they jettison something, it is gone. Except Dr. Spock.
So I don't know if we do have any Star Wars fans in the audience, or excuse me, Star Trek fans. I fancy myself a bit of a Star Wars fan. I made that distinction a long time ago. But the point is, we know what's not working. That's really what I hear when I listen to her speak. Now, it is a pretty lengthy video. We will share it with you if you do want to watch the rest of it. But she does go on to talk more about her work with Kellogg Foundation and about this prescriptive racial healing. She talks about how there is a physical and emotional connection that humans crave positive interactions and positive responses from other humans. And she talks about, obviously that when we're talking about racism, that we're talking about this kind of categorized way of looking at the value of human beings, which our race is human. And we have a lot more in common when you just put folks in the room together. We have a lot more in common than we have, than there are differences. I see chat's a little dry, but you know what? We'll warm up soon enough. And as we go on to the next slide, we're going to revisit some of the concepts we talked about last time. You got a little chance to practice in the intersession work between sessions 1 and 2, and that's choice points. So as you can see here, these are decision-making opportunities that influence outcomes. Those outcomes may be the number of small choices that get you there, but we have to be conscious, we have to be aware when there are and how there are choice points impacting different decisions and impacting different, processes. We have to start to not analyze, we have to start to realize when these are, and that is a way we can deviate from replicating the status quo. So that way we can create a more equitable world, because we don't really know what that looks like. And I think that's why often folks do come to, well, this is always how something's been done, or we're not trying to make waves, or that's not in our purview. You know, I'm sure many of you have gotten these responses before when you try and ask the questions of the way things are done and how there can be a more equitable process. So if we're going to talk a little bit more about choice points, another way of thinking about them is just opportunities. These choice points are opportunities for leaders and managers to really kind of do some reflection and think about ways that you can break and deviate from the status quo. And it's really important to look for these opportunities, because when you get enough of these and you really start to fundamentally change the way that you operate within your organization, then you're naturally creating more opportunities for folks within your organization who have historically been kept away from those opportunities. A little bit of a sneak peek into some of the work we're going to cover between sessions 2 and 3, as well as highlighting more in session 3, is the idea of just having shared responsibility of the racial justice needs across your organization. You know, oftentimes, unfortunately, folks of color and folks most impacted by racial injustices are the ones who are tasked with then leading it with their organizations and externally out in the communities that they serve. So while we do definitely want to have the expertise of their lived experience of those injustices, it's more than just saying, you have these experiences, you lead, it's yours. We want to create a core team of folks that have authority within the organization, authority historically did not have authority within the organization, but do have that lived experience. And those folks should be prioritized because historically their viewpoints are not. And then as we move on to the next slide, we're going to talk again about revisit something from the past session, which is advancing equity through 3 dimensions of time. And when we think about past disadvantage, we're talking about closing the gaps that we observe through data throughout centuries. What this could look like is advocacy for the returning citizen community. We all know how folks who are incarcerated have had their rights really infringed upon and denied, particularly when it comes to voting and having an impact on how they are governed, because that is the whole point, or at least that is what is said is the whole point of this democracy, is we the people. And if you're denying folks the opportunity because of them falling into a system that is meant to keep folks under and keep folks from having decision-making power, that is something and a point that you can look to attack when you're trying to reverse it and create this more equitable way of doing things. Contemporary participation, I think last time I might have mentioned in my work with the Philly Health Department, we had a community advisory board that was started, and that was an effort that we tried to uplift those voices and really intentionally seek out voices who have historically been left out of conversations that really decide how their day-to-day lives operate through planning and through different resources that are there or not within those communities. You'll hear a little bit more about this from our friends at the Santa Clara Health Department, but before we get to them, we want to talk about the 3rd dimension of time, which is obviously the future consequence of letting these disparities linger and disparities. I don't really like to say disparities. I got caught up in some old lingo, but these inequities, letting them grow. We have to look out for things that we know are hurting communities, such as gentrification and displacement from development of cities. Like in my city of Philadelphia, there's skyscrapers and construction going on everywhere where usually it used to be a neighborhood, and demographics are changing. Folks are getting forced out of places that they had lived for generations and their families had lived. So a way that you can seek in your work to really kind of undercut and cut this out could be through attaching yourselves to groups that are doing advocacy on anti-displacement and trying to keep residents from losing their homes and their communities. So I think that is a lot you just heard from me. I'm going to take some time to let the air breathe I see some folks have got the chat going a little bit, but before I pass it off to Laquana, I'm just going to let dead air be and really offer any thoughts, reactions, feelings that are coming up a little bit almost halfway through this session.
Xavier, unfortunately, I can't support you in checking out the chat right now, and I'm really sad that I'm missing out on what's going on there. But thank you all for contributing to the conversation, and you can let me know when I can proceed. Xavier, is it okay for me to proceed?
Yeah, so I guess I lost this game of chicken. Usually folks will just have to get involved with the awkward silences, but it seems that we've got a good group here and they're used to me now. So Laquana, go ahead.
Okay, got it, awesome. All right, so I'm asking you all to bear with me a little bit here today. I'm unfortunately unable to get on video, and I can't see the slides or the chat. So I am going to be navigating this tech situation as best I can. But thank you so much, Xavier, for bringing us up to speed on what we covered in the last session. I know that many of you were there. We got lots of responses to, folks who have participated in the previous session, and we're looking forward to this one. So we wanted to kind of start out by taking a step back and sharing with you all what we covered in that first session. So as Xavier mentioned, understanding truth, reconciliation, and racial healing. And then in that session, we also covered several frameworks around equity objectives. And then today, we're going to be moving a little bit further to talk about some strategic opportunities for what you can actually do to advance health equity and racial justice within your work. So on slide 9, we have the 3 equity objectives here, which you may remember from last session. They are procedural equity, distributional equity, and structural equity. So procedural equity is the transparent, fair, and inclusive process that involves additional opportunities for folks who are disproportionately impacted. And the important thing to recognize and remember about procedural equity is that it acknowledges imbalances in power and technical expertise. So those of you working in the realm of violence prevention, come into this work with technical expertise because of your educational experiences and hopefully also your lived experiences. But there's a recognition here that there are already imbalances at play, in working with community who may not be able to do this work on a regular basis. It also focuses on having authentic voice represented in the conversation. It engages by having folks of color, folks from traditionally marginalized communities, having actual agency over the process and agency over decisions as well. And I think the ultimate thing to remember here is that people in general want to be treated in a manner that reflects that they have personal dignity and respect. And that when decisions are being made, that they have the ability to appeal to a higher authority if they don't necessarily agree with those decisions. So in looking at this work from a racial justice perspective and considering procedural equity, those are some of the things we would want to keep in mind. And then moving from that on to distributional equity, that requires a fair distribution of resources. And it also means, like in thinking about those resources, that we have a fair distribution of both the benefits of those resources as well as any burdens that may come. So a really clear example of this might be something like gentrification. Although there are absolutely benefits associated with changing communities, there are also some burdens for who gets pushed out and who is left behind. So we should be prioritizing resources for communities who are experiencing those magnified inequities. Typically, this is the most quantifiable or tangible one, and it also assumes that there is accurate data to back up how we distribute resources as well. So a social justice and racial justice take on this might look at the criteria we use to evaluate fairness and decision-making outcomes And it will require that we divide those resources equitably, irrespective of prior contributions or input. So sometimes we say, oh, we've reached out to that community a bunch of times and they haven't participated. And you know, there should be some recognition that there are reasons why that might be. Maybe they're overtaxed, right? I know some of you have likely heard that in your ability to bring community into the fold. So that's something to consider as well. And then thinking about structural equity addresses any underlying structural factors and policies that have given rise to the inequities that we see in communities. And the action here is that it makes a commitment to correct any past harms and to prevent future unintended consequences. So it kind of goes in line with what Xavier just shared about the dimensions of time. So this is a framework that's not new to all of you because we talked about it, or most of you, because we talked about it at the last session. But what we wanted to do today was to provide a bit of a real life example. And we are going to be inviting Annie Wu. So Zach, Xavier, if you could work to get Annie unmuted, that'd be great. We're going to be inviting Annie to talk a little bit about her work in Santa Clara County and the Peace Partnership. So Annie, is your mic okay?
Yeah, can everyone hear me?
We can hear you. You sound
Hello?
great, Annie. Oh,
okay. Oh, great.
You sound great. Yeah.
Yes.
So I want to start out, Annie, by asking you about the first equity objective related to procedural equity. Can you talk a little bit about how procedural equity shows up in your work in Santa Clara County?
Sure. And is it okay if I give just a little bit of context for peace?
We'd love that.
Okay,
Absolutely.
great. Yeah. So the Ecell is a peace partnership. Peace stands for Prevention Efforts to Advance Community Equity. So we're located in East San Jose. We work with, we're a collaborative, a very grassroots collaborative made up of residents, CBOs, business associations, and various government organizations. And our goal is to address, to reduce violence and also to promote healing, trauma-informed healing and resilience in East San Jose's 95116, 95122, and 95127 zip codes. So we started in 2016 as a CACHI site, California Accountable Communities for Health Initiative. And so the way that we have been really, I guess, looking at procedural justice, even though we don't necessarily use those terms, but it's really through very conscientiously, intentionally trying to center resident voice, resident leadership, community leadership in our structure, in all levels of our operation governance. And by community, in this context, we mean people with lived experience of, poverty or violence, residents in San Jose, but also the grassroots CBOs, community workers that work directly with them. So we really try to increase the leadership participation and decision-making powers of our community partners in East San Jose. Some of these examples can include overcoming barriers to participation by paying our residents leaders for their time through gift cards, honorarium, stipends, but moreover, really reaching out to residents and listening to them to really ask them questions, not just once, but on a regular basis, asking them, what is it that brought you to join our partnership, right? And what is it you're looking for? What motivates you to want to work on community change or system change? And a lot of them also say it's not about the money. It's not just about the money, but the opportunity to play a role in kind of improving, in like working with systems, to really to be able to participate, to also to gain learning opportunities, to meet different partners, to be exposed to kind of a wider world of institutions and systems. And so we really try to have to build in those opportunities for them. Like, for example, we every year the backbone organizations of public health and some of the institutional leaders for peace, we get invited to kind of a day-long convening somewhere in California that's funded by, the overall initiatives organizers. And for each and every one of those opportunities, we always invite our resident leaders and we pay for their travel expenses just to be able to give them that exposure. And that was just something that they really appreciated, and that kind of kept our resident leaders, kept their participation, kept their engagement.
Mm-hmm. That's excellent, Annie. I think, you provided some really innovative examples and ideas about how you all are advancing procedural equity in your work in the Peace Partnership. Can you talk a little bit about distributional equity in your work?
Sure. So for what I understand, distributional equity is really talking about the distribution of resources, benefits, and things of that extent to people with lived experience. And so the way that the Peace Partnership is structured through the Kachi model, we have something quite innovative. We have a wellness fund, which is really kind of a community. It's really a pool of funding that's really supposed to be held by the community, and it's supposed to be very, very flexible in terms of how it's used. It braids and blends different types of funding together to pull together to be used as directed by the community. And so in our partnership, we have set up a leadership team consisting of different stakeholders, including resident leaders, that get to vote on how this money is used. And we kind of very intentionally set up the proposal process and the grant making process, the application process for the Wellness Fund to be extremely low barrier, very easy application process. A lot of the proposals that come in through word of mouth or just very informal. So one example is during the COVID-19 pandemic last year, back in April, really a lot of our resident leaders came to us and told us that there's a lot of people in East San Jose who've been left out of the more traditional government funding schemes, whether it's because they don't have documentation or they just don't, they don't show up on records, or they just don't know how to apply. The barriers are too high. And so we really mobilize our partners and use their kind of relationship with their donors to fundraise money for these kind of underserved community members. And so over the period of, I would say, 3 to 4 months, we actually raised over $600,000, and we distributed it to over 730 East San Jose residents, as well as over 30 small businesses and micro businesses in East San Jose, to be able to get that relief, a little bit of financial relief out to them. And it's not just through the fundraising aspect, but the distribution aspect. If you can imagine trying to move money out to over 700 people is extremely difficult, and we would not have been able to do it without our residents and their networks, and the resident leaders really taking a stand and owning this process. And that includes a lot of trust, right? That includes a lot of almost like abolishing or just skipping over some of the more traditional kind of administrative barriers, bureaucratic kind of processes that would normally come with moving that much money out into the community. So somehow we were able to do it, and a lot of that has to do with just trying to do things in a new way, trying to find new way, more flexible way to respond to community needs.
Absolutely. I love that you all were able to take a look at, your internal processes and decide where you might be able to make some improvements in order to advance distributional equity. Because I think we all know, everyone on this call, how difficult it is for small community-based organizations to work alongside large bureaucratic agencies like health departments, and to do things like, get funding out into communities. So this is an excellent example. Next, I want you to share a little bit about how you all are thinking about and prioritizing structural equity in your work. I know most folks are familiar with what structural equity is, and I'm wondering, how that's come up for you all in East San Jose or in Santa Clara County.
Yeah. So in our peace partnership, we definitely, like I mentioned before, I think we made a very intentional decision at the very beginning to center resident voice and to really kind of do whatever it takes to kind of not just to work toward equity, but work toward kind of anti-racism, use an anti-racism framework, right? Like really kind of battling against this business as usual or status quo approach, and really examining our assumptions, our beliefs, our preconceptions to kind of change the way we do business so that community members can truly participate in a meaningful way. We have used several frameworks. I'll highlight two to really think about, how to operationalize equity, right, or structural racial justice, as I guess the term is used here, to move it beyond kind of a vision and an ideal and a theory and things that we write in our work plans to like actually make it happen. And at the end of the day, when we ask our residents, have you felt, equity in your experience, in your interaction with us, that they would also confirm, what we're trying to do. So some of the frameworks we use, one of the frameworks we use is, thank you, Prevention Institute. We use the ACER framework, which I don't know if audience here have, is familiar with this, but it's the adverse community experiences resilience framework, right? So it's three components truly spoke to our work, and that the three components are equitable opportunities, which speaks to economic and education opportunities, people, so that it's about social and cultural environment and making that cultural shift. We think about violence, and place, that's the built environment. So for us, we understand this as, when you want to address violence, right? It's not just about taking the bad stuff away. It's not just about taking the criminals off the street or gangs off the street or guns off the street, but it's about putting more good stuff in and truly investing in community as a long-term pathway out of violence. That's one framework. Another framework we have been using, especially in our planning evaluation, is called racial equity focused results-based accountability. This is a special kind of a framework developed by Erica Bernabe, our consultant. So this is really applying an anti-racist framework to an already established the results-based accountability model, and using that anti-racist framework to really examine in all levels of our system institutional practices, both micro and macro, the way we work with communities, by looking at the actual impact. So looking at exactly what we do and asking ourselves, are the people we're trying to help, are they really better off at the end of the day, after we have done all these things to them or for them? So I just want to talk a little bit about our anti-racist orientation that we have kind of applied ourselves to. This is how we understand this as I mentioned again, it's really actively kind of challenging how we do business as usual, right? And understanding that you can't just get equity from wanting equity, you kind of have to really change and move, the way you work. And so practically speaking, what this means for us is really actively trying to get away from tokenism when it comes to community engagement or resident engagement, getting away from the checking off the box, right, as people like to say. So not just about inviting certain residents or resident leaders to sit at panels or tables or, consulting them to get a decision made, but really asking yourself, when the resident is sitting at a table, are they actively participating? Are they pushing back on you, on what you're proposing? Are they offering different ideas? Are they sharing their thoughts, experiences, lived experiences? Or are all you're getting is kind of their agreeableness? All you're getting is like, you ask them, do you have an input? And they'll say a few things, or you ask them, do you agree with, this agenda or these decisions? And they say yes. If that's all you're getting, then maybe there's something wrong, right? Maybe they don't feel comfortable speaking up, or they don't understand, or they're not invested. Either that, or maybe you don't have a diverse enough representation that you actually need. So understanding that it's hard when you reach out to people who are different from you, when you reach out to communities with lived experience, you are going to get pushbacks. You are going to get, misunderstandings or different understandings. You are going to get that possibly historical generational trauma that you have to deal with, right? But really investing the time to work through that and really kind of going for a meaningful engagement with people so that they can actually participate in the decision-making process.
Annie, I really appreciate you sharing that. I think you just brought to life this framework so well. I know there was a question or a comment, question in the chat about you potentially sharing some best practices for how to set up something like a wellness fund locally. And I'm not sure that's a big question. So I'm thinking maybe, you might have a quick response to that here and we might follow up via email on that. But also wanted to let you know that we shared the links to your website online in case folks are in the chat in case folks are interested in learning more. And we also shared the ACER framework. But anything you want to say in closing, Annie?
Yeah, just that can you still hear me?
Yes, we can hear you.
Okay. Yeah, so I can definitely, regarding the Wellness Fund, I can definitely share a little bit more resources through Kachi, our funder. But basically, it's a Kachi model. It's a component of a Kachi model that we were able to implement, in our collaborative. Of course, it does take a lot of convincing kind of traditional partners, especially government institutions, to do something like this. So for us, we were able to get a little bit of seed funding, I believe, from the reentry program, so one of the programs in our county, and the money was held through a third party, we'd call like a fiscal operator, right? So for us, it's the Valley Medical Center Foundation, which is, I believe, associated with our county hospital system, but they are a nonprofit kind of external entity. So they're the ones that hold the money. And then moving forward, we established a finance sustainability committee to kind of govern the use of this money. And then, of course, a part of that is also ongoing fundraising efforts. So trying to convince funders, donors of this new model of funding where we're asking them to give money, put money into this community pool without kind of attaching the money to any specific proposals or projects or outcomes, short-term outcomes. So that's something we also have been working on. But I can definitely share more information about the Wellness Fund. I can just send it to you, Laquana.
That would be great. Thank you so much, Annie, for answering that question. And for sharing, the work that you all are doing in Santa Clara County. More to come on that. Zach, Xavier, if you all could take us to the next slide. Thank you. So next, we're going to talk about strategic opportunities to advance health equity and racial justice. And I think this goes hand in hand with exactly what Annie just kind of walked us through in her work. But we're hoping that we can provide you all with a bit of a framework to kind of wrap your brains around how to advance this work, because we recognize that it's so big, and we want to make it as action-oriented as possible. So today in the strategic opportunities, we are going to be walking you through one of 3 strategic opportunities that we've laid out. There are a total of 5, and so you'll see the other 2, and we'll come back to the first 3 in the next session. But we're going to start out with the slide on strategic data creation and analysis. So everyone knows, particularly in violence prevention work, how important it is to have relevant and accurate data. And people working to eliminate racial injustices really bring a keen analysis to the historic and present day factors that drive gaps and wedges in our health outcomes. And so a best practice here is aligning analytic frameworks for both health equity and racial justice so that practitioners, which are you all, have the opportunity to really paint a clear picture of inequities, to articulate what the root causes of those inequities are, to identify any levers for change, to identify power analyses that help you to understand where those levers of change are to begin with. It also helps you to clarify indicators so that you can measure improvements over time. And it also allows you to increase synergy and enhance your strategies as you work through some of these issues. So when we work together, both racial justice and health equity practitioners, and some of us are hopefully wearing the hat of both, we can then begin to identify the most impactful data and metrics so that we can demonstrate where our best efforts align and intersect. And I think this is super important, especially in violence prevention work, because your data tells a story, whether you provide context to the data or not. So people can pick it up and, you know, interpret it for what they will. But when you work in this particular sector, I think it's important that you recognize that work around violence prevention is almost inherently raced because of the history of our country. And so when you have an awareness of this, you can hopefully mitigate or think further down the line to prevent any unintended consequences of data being misinterpreted or even just left to interpretation so broadly that it gets misconstrued in some way. So the data we know here is an important piece. We also want to reflect that data back to communities so that they can utilize it to the best of their ability. The next slide looks at strategic framing and communication in violence prevention and in thinking about racial justice. So communicating and speaking about racially unjust health inequities is challenging. And I think that's something that we all have to acknowledge. It's not something we should sweep under the rug. We should also recognize that people are starting from different places in this conversation. So we, you know, today are talking about racial justice very freely and openly. And in some communities, that's just not the case, right? Depending on where you are in the country, the political views in your current area, you may not be able to speak about it as freely as other folks. And so being strategic about your communication while also not sweeping it under the rug is super important. I think the other important thing to mention and note here is that naming racial justice does not preclude other intersectional forms of equity. So oftentimes, you know, you might mention or bring up, hey, we really need to look at this from a racial justice perspective. And your colleagues or other folks might look to you and say, well, hey, but what about gender? We need to talk about that too. Or what about disabilities and how that impacts people and communities? We need to talk about that too. And all of those things are true. Those things can all be true at once, right? But naming and talking about racial justice doesn't preclude you from talking about and dealing with those other issues. It actually opens a door for you to be able to address some of these issues in a way that's intersectional and allows for you to get to the root of some of the inequities that we see. We also recognize in our strategic framing and communication that health inequities won't be eliminated if we don't actually deal explicitly with talking about and addressing racism in our programs, in our policies, in our practices, and our norms. And again, we have to learn to converge the languages between folks that, you know, are working in the health and violence prevention sector with the folks who are, you know, true racial justice advocates and are doing the work on the ground and in community. There's nothing worse than being, you know, out of touch with your language and your lingo in a way that has folks feeling like, you know, you are not addressing their true issues and concerns, or that you are sweeping them under the rug, or that they can't even meet you where you are because you're too far ahead. So the speed and the pace and the calibration of that is particularly important in this kind of work. The third one is about effective multi-sector partnerships. And when we look at effective multi-sector partnerships, it's important that we identify win-win solutions across our organizations. So that means looking at things like mandates and activities, and back to the first slide, data that's collected. Because when you look at these things, the insights that you will gain from them will help you to identify new and different opportunities for engagement. So kind of like what Annie was sharing earlier, it's not just about having folks at the table, but having them at the table in a way that allows them to also share their best insights, show up as their full selves, and bring new and different things to the conversation. So when you have these effective multi-sector partnerships, you're able to increase your available resources and your strategies, and of course your capabilities. You learn more, your team learns more. You have the ability then to shift organizational cultures, practices, and norms. You can foster some of that cross-site, cross-sector learning and innovation. So just like we learned about what took place in Santa Clara County today, maybe that's not the exact program or process that you can replicate in your particular community, but at least you have some ideas for what you might be able to begin to do that's specific to improving the outcomes in your community. And then finally, we're able to also generate new ways to catalyze and sustain systemic change when we engage in these partnerships that are multisectorial and diverse. So I'm going to pause there and actually take us to the next slide, which gets us to a little bit of a discussion question. I tend to find that when going through these strategic opportunities, people typically, even if these are all new for them, typically are able to, respond to that third one, because for a long time now, folks in public health, violence prevention have really been moving forward multi-sector partnerships. So I want to ask you all, and you can unmute yourselves or respond in the chat, to describe how partnering with community might look different when you're applying a racial justice lens. So maybe some of you have already tried this, maybe you want to try it, but you are having some hesitations. Feel free to respond in the chat about what's come up for you related to this. And if you have tried it and you've seen some results, please feel free to share that as well. Zach, Xavier, I'm going to turn it back over to you to let us know what's coming in the chat as folks are responding there, and then to continue to open it up for conversation verbally as well.
Yeah, thanks, Laquana. We only have a few minutes left, but I definitely do want to give folks the opportunity to either, answer or respond to this in the chat. I know a lot of folks have talked about paying people for their time and expertise. If you ask me, that's probably the number one thing that you should be focusing on. Make people feel encouraged, like they are part of the solution, and then they will actually, want to give you their time. They don't owe you their time, and we actually do, in the work we do, work for those folks. So again, if you want to hop in, please go ahead and keep the chat going as we begin to close out this session.
This is Hector. Thank you, Xavier. I think this is Hector, Los Angeles County. I think, throughout this conversation, I think one of the things that was highlighted, even in the situations of paying folks, which is essential, is that oftentimes this equity works are not accessible to people with disabilities. So it's always about making sure that not only the spaces are safe and equitable, but that they're accessible. During this pandemic, I think one of the struggles that my disability peers and I have had is really participating in a lot of the social justice, spaces that have the racial justice spaces that happen, because they don't really provide accommodations for people with disabilities like myself. So for example, this webinar has closed captions, which is fantastic for those of us who are deaf or hard of hearings. But a lot of the spaces are not at all accessible to us. And we exist in every racial, ethnic, population. So it really, again, just highlights the importance to make sure that accessibility is definitely an equitable principle that without it, you're really not meeting the point.
That's an excellent point. Thank you so much for sharing that. And I think it just also highlights how important it is for us to continue to work together with folks outside of our realm or outside of our sector, because then we realize, you know, that there are gaps and barriers, and these barriers have unintentional or sometimes unintended consequences. So thank you for sharing that. Anyone else? Any other comments, questions? Hearing none. Okay, I'm going to turn it over to you, Zach. Thank you all so much for your time.
Thanks, Laquana, and thanks everyone for joining us today and for your participation. We hope that you'll join us for the third and final session, which is going to be on Tuesday, November 16th at the same time from 11 to 12 Pacific. Right now, because of the Zoom meeting format, our registration's capped at 300. So if you go to the registration link, you'll see that it says it's closed. I'm going to reach out to Zoom and see if we can maybe get a wait list set up so that you can still be notified of any updates that happen through Zoom. But we, after the first session and after this session, we've been sure to upload the recording from today as well as the slides to our Prevention Institute page for this event series. So you'll be able to visit those in the event that you either can't make the session or if registration stays capped. But go ahead and keep an eye out via email. We'll be following up again with those slides from today and some additional resources about the frameworks and some intersession just opportunities to continue engaging with you between now and November session. So with that, that about wraps up. If you have any questions, go ahead and reach out to any of us here at PI. Our email addresses are here at the bottom of this slide, but we are a little bit over time. So thank you so much for joining and have a great rest of your day.
Thanks, everyone. Thanks, Annie. We appreciate you. We look forward to seeing y'all next time.